Do you snore? We talked about it a second ago. Maybe you don't even know that you do.
And most people deny it too if you ask, do you snore? Oh, no, not me.
Because you're sleeping when you're snoring, right? Well, they say 1 out of every 2 of us do it.
And some of these people have a much bigger problem because they actually stop breathing during sleep. Joining us now is Dr. Madan Kandula with Advanced Ear, Nose, and Throat Specialist, also known as Advent. Welcome back to the show,
morning.
Doctor. Okay, a lot of people having the problem with snoring and then sleep apnea. If you snore, do you have sleep apnea?
No.
Okay.
But the opposite is pretty much always true. Everybody has sleep apnea, snores, and the hard part is figuring out, what is what. Is it just? It's always annoying. Is it annoying, or is it annoying and deadly, or is it just annoying? Basically?
So can you basically save marriages?
You can really.
Your claim to fame.
That's right. No, I mean it's a really, it's devastating on the individual, but it obviously affects the whole family.
Yeah.
It's whether the snoring or the sleep apnea.
Let's talk first on just what sleep apnea.
And this little shows, this actually shows snoring, and it's kind of hard to make out. This is actually his head in half and had him go to sleep, and if they were still able to sleep, then you see the back of the throat back there. That little wavy blue line is where the airflow is getting disrupted, and that's where the sound comes from. So that's the back of the throat. This is showing sleep apnea. So this is the other extreme. So the blue stops. So meaning that somebody's snoring, and then they stop breathing and the air stops flowing and
they actually stop breathing. For how long sometimes?
It can last over a minute. At times, there's people who do this hundreds of times every hour. It's pretty amazing.
And it can lead to some pretty serious health implications, correct?
Yeah, absolutely. It increases your risk of heart attacks and strokes by 6 times over the general population. It's high blood pressure and just being kind of in a crummy mood all the time.
It's not just being tired and snoring. It can lead to some serious health issues. And one of the ways to treat it is using a CPAP.
CPAP, exactly.
And describe what that is.
If you think of your vacuum cleaner and you hit it on reverse, if that was possible, it would be pushing air out instead of pulling air in. And this is showing what happens. So this same individual was stopping breathing, and the blue is starting to be able to flow. The machine fits on either the nose or the mouth and the nose and just pumps air in, and it pushes things open. And when it works, it works.
And it's kind of what they consider the gold standard in treating sleep apnea for a lot of people. Is it possible that some people will be able to use CPAP, that machine, even after having nasal surgery? Yeah, I mean, some people aren't able to tolerate the machine for various reasons. Some people just are claustrophobic and it's just not going to happen. Other folks, if your nose is blocked and the machine is trying to pump air through your nose, it's not going to go anywhere. And so a lot of times I see folks not able to tolerate their CPAP machine, and it's relatively as simple as just fixing their nose and the machine's able to work for them.
And if you do have to have surgery, because that's another option for some of your patients, what's the least invasive way to do it? I'm sure you get that question all the time.
Yeah, there's something called a pillar procedure, which we've talked about in the past here. And all that is putting implants into the back of the throat. And what those implants do is they stiffen up the palate. So instead of removing any tissue, we're just actually putting some, and this just shows that in the back of the throat there. Material goes in. We just do it in the office. It's very new, and it tends to be very, very effective for people who are good candidates for that specific procedure.
Pretty good too.
Most of the time when I do it, I'll do it and I'll have them. People can go back to work or school right away. It's just like going to the dentist office. Much
different than having your tonsils out, probably, because a lot of people remember having their tonsils removed as kids, and I wonder if that can be helpful for kids who snore or have sleep apnea, because there are children who actually have sleep apnea.
Yeah,
right?
a lot of kids have sleep apnea, and most of the time we don't really even know about it. So if a child is snoring, that's the first red flag that something may be going on. A lot of times there's issues with behavior, bedwetting for an older child, lots of different things that they don't know any different. Their bodies are trying to tell you or those around them that something's going wrong.
Are there other surgical options other than the implants that we talked about?
I guess really up above that on the ladder of sort of options comes to things where we're actually trying to reposition the tissue in the back of the throat. So even an adult who hasn't had their tonsils out as a child will take those tonsils out, and this shows that. It's kind of hard to make out, but on the left is before surgery, on the right is right after surgery. What we're doing is removing the tonsils, removing the little dangly thing in the back of the throat, the uvula, and actually just sewing things back up so it's an open airway. And this shows a similar sort of procedure, going left to right, then removing the uvula, flipping it up, and basically just opening up the airway. So
I didn't know you can actually remove that.
Oh, yeah. Yep, we do it routinely, actually.
And what kind of recovery times can you expect with those types of procedures?
Those definitely are more intense. And so usually it's about a week off of work where you're just, it's the same sort of situation as somebody who's having their tonsils out, where it's not particularly a fun week. So that's a whole different ballgame than the pillar procedure is, or even if we have to do nasal surgery, nasal surgeries tend to be pretty low key compared to the bigger procedures.
Let's talk about success rates too, because when you throw in surgery and doing things like that. People want to know, okay, this problem is going to be taken care of if I go through with this.
And that's the hard part as far as sort of everybody's different, and kind of our theme, I think, all along has been trying to figure out, what's the specific best outcome for an individual patient. So it really depends on somebody's anatomy. So really it depends on, do they have big tonsils? Is their palate really droopy? What degree of sleep apnea do they have? And a lot of folks never really get into that situation. They find they have sleep apnea and they're thrown a machine and sort of sent out the door. And which works for some folks, but a lot of folks are kind of missing the boat. And so folks that just really aren't getting what they need, it's just a matter of getting in, having somebody look at it with trained eyes and trying to figure out what's the best option for them.
And that's one of the things I know you help people do, because obviously, clearly, if 1 in 2 of us snore, a lot of us then also have sleep apnea, and it's something people should have checked out. I'm going to put up the information for you can call their office located in Wauwatosa. That phone number is 414-771-6780. Also, a web address is advent.md. Advent stands for Advanced Ear, Nose, and Throat. Nice to have you, Doctor.
Thanks
for chatting with us.
Thank you very much.
And take a look at this book. I am not talking so much about